What does the sense of community mean to you?
Wanda Jenkins has been fighting addiction for more than 3 decades. Thanks to help from the Northern Shenandoah Valley Substance Abuse Coalition, it's a battle that she's winning.
My father was a severe alcoholic, and he used to beat my mom all the time. And he used to throw me out of the house, and so I'd sleep underneath the porch. There was something always missing in me. I never felt good enough. So at the age of 12, I had my first drink, and then at the age of 16, I had my first rehab. During this time, I was in and out of the psych ward, just a lot of mental issues and things, suicide attempts. I was so ashamed of myself, I couldn't deal with the feelings. I couldn't even look in the mirror.
How has that been for your recovery and rehabilitation?
I think bringing awareness to the addict.
People like Wanda will get help from a new law enforcement overdose intervention program. It's a team approach that includes peer counselors, a role Wanda is now training for.
If you had a program like the Law Enforcement Overdose Intervention Program when you were still using, how do you think your life would have changed?
Wow. I think it would have probably changed greatly. I didn't have hope, and I didn't have anybody to bring me hope. So I think that that would have impacted my life very much.
Seeing that a program like that is coming into existence now, what does it make you feel like?
I'm very thankful because of the ones still suffering. They have a chance now. They have a chance not to see bars or have a criminal record, and to bring, hope to them and say, hey, there is a better way.
So you are entering into a program to become a peer counselor yourself.
Yes. I think that that's the closest that you could ever get to having help as an addict, is to have somebody that has walked in the same shoes as you. I had to help others that still suffer, and to tell my story and to let them know that it can be done. It can be done, and there is help out there.
Wanda has come a long way in her recovery. When she completes peer counselor training, she'll be able to share what she's learned with those currently struggling with addiction. The Law Enforcement Overdose Intervention Program is a unique way that Virginia is helping those with opioid use disorder. The program is currently being coordinated by the Northern Shenandoah Valley Substance Abuse Coalition. I talked with its executive director, Lauren Cummings.
We received a grant to start a law enforcement overdose intervention program. One of the biggest things we're working on right now is our peer recovery programming and expanding that. We are mobilizing a multidisciplinary team of a law enforcement officer, a counselor, case manager, and peer recovery specialist who will respond to all of the overdoses in Winchester, Frederick, and Clark County. Instead of taking the person to jail, they will offer the individual treatment so that they can get well. And if they engage in treatment and they really start to change their lives, then they're not going to be charged.
Traditionally, the police have simply arrested those involved with drugs. We wanted to find out how this program is shifting that mindset. So I met up with First Sergeant Josiah Chavone of the Virginia State Police.
We're having to go out and train the officers that we have, the street level guys that are the first to come in contact with these people, and explain to them, hey, there's a job outside of just taking them to jail. They need medical attention and they want help. I'd rather somebody live than go to jail. And that's the message we try to get to our new officers out there.
We have law enforcement officers who used to be the ones who would pull someone over, find the drugs, and arrest them immediately. They've completely changed their perception of these individuals, and they're starting to really engage in their lives. One client, for example, needed a bike, and who was the first person to go provide that bike? It was the law enforcement officer.
The program is funded by a grant from the Aetna Foundation. Their president, Dr. Garth Graham, told me why they're supporting it.
What we saw here was an innovative idea, pulling together local law enforcement, case management, local leaders, other folks from the clinical side of things, pulling them together to reach individuals before they really become a part of the penal system.
What can other communities learn from the program that you're providing?
You really have to get the community engaged in what you are doing. You have to look at these individuals in a non-judgmental way and realize that many of them have never had an opportunity at treatment. We want to change the trajectory of this issue, and we really want to make a difference in our community.